So can you talk a bit about the presentation you're giving at CCR East?
Sure. I am going to talk about pregnancy and related issues in patients with rheumatology disorders. Why is this an important topic worthy of a talk? Well, our rheumatology patients are prone to having more complicated pregnancies than the general population. And it's important for rheumatologists to understand what the potential issues are, to know how to evaluate them ahead of time, which is really critical, to know how to advise, monitor, and treat them during pregnancy and after pregnancy as well. And I would say another important issue is that of medication use. As we are fortunate enough in rheumatology to have increasing numbers of medicines that are helpful for our patients, it brings up the question of which of these, if any, are suitable to use before, during, or after pregnancy. And that's another area that I will cover in my talk as well, because that, again, is something that's changing all the time as new medicines come out and also as more data emerges.
So are there certain rheumatic diseases that are more, I guess you can say, worrisome for pregnant patients that
Absolutely. So, and in my talk, I do focus the most on two disorders, systemic lupus and antiphospholipid antibody syndrome. And that's because these are the two disorders that historically have the greatest risk for pregnancy, both for the health of the mother and for the outcome of the pregnancy. They coincide at times. About a third of patients with lupus do have antiphospholipid antibodies, and so a patient may be dealing with both of those issues. And in fact, it's likely that having both of those issues further increases her risk during pregnancy. So we have specific guidelines and recommendations for how to assess these patients. And for our lupus patients, our antiphospholipid patients, and all of our other patients, we really do strongly recommend having a pre-pregnancy assessment. I usually tell my patients, early on in our relationship, that pregnancy is an important issue and that we need to talk about whether or not they're interested in becoming pregnant ever, sometime soon. And if not, we need to talk about the opposite of that, which is, safe and effective contraception. So these are all things that rheumatologists can help their patients with. And in fact, we probably see the patients much more often than their OBGYNs do. So it's important to assess ahead of time, because if the patient has certain issues that will make pregnancy riskier, we can identify them and most of the time, although not all of the time, change them. So what do we look for? We look for active disease, whether lupus or even rheumatoid arthritis or other disorders, because it's almost a universal finding in this area that having active disease, with any rheumatic disease prior to or at the time of conception does increase risk, both maternal and pregnancy related. So if disease is active, we counsel our patients to hold off. We treat them appropriately, try and get things under better control so that the timing will be better in the future. We also have to look at medications. Obviously, as I mentioned, some medicines are felt to be compatible with pregnancy. Others that we use fairly commonly, such as methotrexate or mycophenolate, are potentially teratogenic and can cause birth defects. So patients need to be aware of that, of course, while they are on the medications and need to be using effective birth control. But we need to stop them in a timely way. We may need to put them on other medicines that are safe for pregnancy and make sure those work for that particular patient. So there may be a lot of adjustments that we want to make before a patient actually starts trying to conceive. And that is our best chance for the most successful pregnancy outcome.